Dr. Raymond Jean with Mainline Plastic Surgery. I'm a board-certified plastic surgeon practicing in the suburbs of Philadelphia, Pennsylvania. And today we wanted to make a short video to discuss one of the common questions we get from our patients who are seeking breast augmentation surgery or breast enhancement surgery. What is the difference between saline and silicone implants? Saline implants are a silicone shell filled with salt water or saline solution. It's the same solution that is used in IV infusions if someone were hospitalized. A silicone implant is a silicone shell nowadays with a highly cohesive silicone gel within it. And what that means is that even if you were to cut or to get a hole in this implant, the silicone retains its shape. It's a solid silicone, highly cohesive once again. The advantages and disadvantages first to saline implants. Saline implants, the advantages, they do cost slightly less than a silicone implant, and that's based on manufacturing costs. The other advantages is you can use a slightly smaller incision, as the saline implant is not filled when it is placed into the breast, but after placement it is filled. That also leads to the advantage of being able to make very minor adjustments within the fill volume of a saline implant versus a silicone implant that comes pre-filled. With a saline implant, we can make adjustments up to 1 ml, 5 mLs, whatever volume we want to in terms of the final fill volume of the implant in order to achieve the best possible size and shape symmetry between the breasts. With a silicone implant, we are not able to do that as they come pre-filled. Disadvantages to the saline implants are that in women who have thinner skin or thinner overlying breast tissue, if the implant is placed in those women, you may be able to see rippling, most commonly on the outer inferior or lower portion of the breast, and sometimes on the upper internal or medial portion of the breast. Also, the feel of these implants, not only when the patient or someone else feels the breast, but also just the in general feel inside the body, does feel less natural than a silicone implant. Some women report feeling a sloshing or movement of the water within the saline implants, although that is not very common. Silicone implant, the advantage is it is a more natural feeling implant, both to the patient when it is placed and also on the breast. It feels more natural. It does have less chance of rippling within the breast when used for breast augmentation, especially in those patients with a thinner skin overlying the breast or less breast tissue. Disadvantages to the silicone implant are that it does require a slightly larger incision. On average, we're talking about 1.5 centimeters, which is not that much larger than the saline implant, but it does come pre-filled, so the incision needs to be slightly larger to place the implant. Both of these implants are FDA approved. They're both very safe and used commonly for breast augmentation. I would say that most women nowadays are choosing silicone implants because they do feel and look more natural than saline implants, but there still are a select group of women who prefer the saline implant, which we are using. But by and large, most women nowadays are choosing silicone implants. We will produce further videos discussing the overall breast augmentation process, sizing, and another common question we have in terms of profile, meaning low, moderate, or high profile, or in some instances, moderate plus, or high profile implants. Thanks again for watching, and if you'd like to contact us, please click on the link to contact us to schedule your consultation for breast augmentation or other cosmetic surgeries.